Okay, thank you. This is such an incredible turnout. It's pretty, I don't know, it makes me a bit nervous actually, but I guess next time we'll have to get Convocation Hall or something for our meetings. But thank you so much for the invitation today. First, before Alex and I were just talking about who's in the room, and clearly we'll take up the whole hour and a half if we ask everybody to introduce themselves, but just a show of hands of who has done mixed methods or tried to do mixed methods or... Okay, so quite a few of the group. Yeah, forced into mixed methods would be against your will. Okay, good. Oh, that's good. Yeah. Okay, so that's good. So everybody sort of comes to the table with some kind of experience or knowledge. So that's great for this group. So my background, the reason I said a reformed quantitativist is I spent the first sort of 10 years of my research career in doing clinical trials in orthopedics. Where we only measured very specific things and outcomes that we as clinicians or the clinical world were interested in. And we also did a lot of very large clinical trials. Actually, I did my career there at Western, and so we did a lot of large international clinical trials and never changed practice, never did anything with the results. We just kept doing what we were doing anyway. So I thought, this is crazy. Like, well, there's got to be something better. And at that time, knowledge translation and dissemination was just sort of coming to be a thing. I seem to be on the edge of these new methodologies in research. But anyway, so I actually came to Toronto and got very interested in knowledge translation and implementation science and quality improvement in healthcare as a way of actually investigating how to use research results to improve health and health outcomes for patients. And so, you know, as I came to understand, I had that experience in quantitative, but I knew that really what I was interested in finding out about would be answered by qualitative methods. So I signed up for a PhD, and the September of that year walked into Pia's course in Qualitative 101. And started from ground zero to learn qualitative methods and have never really looked back. So I have come from I guess, a training standpoint of trading teams, I guess, or being traded. And so sometimes I wonder if that is why mixed methods appeals to me, because I actually have an appreciation for both sides of the ball and what both types of methodologies bring. And because my research is largely in quality improvement, knowledge translation, really it requires mixed methods because of the types of things that we measure, that we look at. So someone may pick outcome measures that are important clinically, or may pick outcome measures related to the implementation of a guideline or a new practice, a new clinical practice, that, you know, to measure the number of times that test is used. But the other side of that coin is, how are people taking up that guideline? How are people interacting with it? You can measure all you want, but if you can't appreciate whether or not the staff are happy about what's happening or really believe in the guideline or understand the knowledge, things like that, that are obviously lend themselves more to qualitative, then we still don't get very far in producing knowledge about dissemination and implementation. So the type of research that I do, it really benefits from mixed methods and from multiple people coming together. I think the difference between Alex and I is that after I did my PhD in qualitative, using qualitative methods, I stayed in qualitative, so I never went back to doing quantitative methods, but I can still read the odd quantitative paper and understand what's going on. But so I partner with quantitative folks to do mixed methods research. So we come together and design studies together, and I, you know, take the qualitative lead, and then someone would take the quantitative lead. So that's sort of how I approach 99% of the work that I do. I guess I should use the slides I sent. So I'm not going to read this, but, you know, I think one thing that I would say in terms of explaining my approach and my experience with mixed methods is that there is a core set of assumptions that we all have to agree to. So, you know, I hear a lot of folks who come from one side or the other talking about mixed methods, and really, the argument boils down to worry about rigor and validity. And so I think at the beginning, when you embark on mixed methods, if it's the way I do it, which is a qualitative person partnering with quantitative people, you have to start from a place of assuming that everyone is going to do the research in a very high quality, rigorous way, rich, robust way, and that each side is going to appreciate the rigor and robustness that comes with the other methodology, and not to, who's the primary or the secondary or creating a situation where one is better than the other or more important than the other. And I've been very lucky in my mixed methods career that I've worked with people who have wanted to come to the table and to understand what qualitative could bring. So I've never, although I've had to do lots of convincing along the way, or teaching along the way, I guess, educating along the way, I've always entered a room where people were open to understanding how qualitative could make the study better. So I can't really speak to an experience of where I was relegated to second fiddle, so to speak, or anything like that. I've always worked with people where it's been considered equal. So also, I come from a very pragmatic standpoint. So when a question gets asked, and if that question really can be seen from both sides, quantitative and qualitative, I think that's how we have to approach it, so that it's not a quantitatively driven research or qualitatively driven project, but driven by the research question and what methodology will get us there. I think that's sort of my fundamental belief. You've had experience with mixed methods. You know where it's useful. I do firmly believe that the benefit of mixed methods is leveraging the strength of both methodologies to give you a much more wholesome answer. I use that word loosely, but answer to the question that we're looking for. There will always be areas where mixed methods isn't appropriate, where it is a qualitative question or a quantitative question. But I think there are, specifically in the area that I work in, there are lots of questions that really do need both, and that when we publish a paper that's just a measurement of how many people used a CAT scan, it's actually detrimental to the knowledge base, because it doesn't tell the whole story. And we talk a lot in knowledge translation about replicating results or generalizability and things like that. And although I do, I'm not sure that those are great concepts to be discussing, the ability for people to use knowledge once it's published in their own setting is hampered sometimes by a lack of a better understanding of how and why and by who something was tested or implemented the first time around. So I think that's where mixed methods has a really important piece to contribute. Again, not to beat a dead horse, but scientific rigor is imperative. So you can't be asked, although many times in my career I've been called and said, so we did this, it didn't work, could you do a quick and dirty qualitative study to find out what happened? I get that call a lot. I'm sure if I asked you, people would put up their hand that they've gotten that call a lot as well. And so I'm by no means suggesting that that's what I define mixed methods as. Definitely, mixed methods has to support scientific rigor on both sides. People have to, take up the tenets that are crucial to both methodologies, and believe that the answers or the information that we gather from both methodologies is equally important. So, it can be very difficult. I'm going to be perfectly frank. It can be very difficult to convince some people who have lived in a quantitative world for a really long time that it's not just your opinion that you forced on other people that you're now reporting, that you didn't go into your office and make it do some hocus pocus and figure out the qualitative findings. So that can be really hard. But again, I think that we've come a long way. The paradigm wars have changed over the years, and I think there are a lot more people who are more open to what qualitative brings to the table in healthcare, for sure. So again, this is the idea that sometimes people think that this of qualitative something, and I think sometimes this is what people think happens in mixed methods too, is that because we haven't done a very good job of supporting well, there are very good examples of mixed method studies published. It is hard to do that with word limits and things like that. Open access is helping us with that. But so that we haven't had a lot of good examples of mixed methods write-up. And so I think people still say, oh, people do mixed methods, but they're not really sure what actually happens in the room when you go to mix the methods. And I think that's one of Joan's key points, is that it ends up being sort of this nebulous thing that happens in a room at some point, right? And so, I mean, I can honestly tell you that in my experience, and I'm going to go through a couple of examples of studies that I've done that are different types of mixed methods. So we did a sequential mixed method study where we did a bunch of qualitative work up front to inform a Delphi consensus survey. They really didn't know where to start in terms of determining the questions for the Delphi, and so we went out and did a national a huge qualitative study to inform the development of the Delphi. So that was, that was more the case of us being able to bring the richness of the data to then inform the next step. So there wasn't as much, the mixing was more of in a development type way, not necessarily combining the results. And then after the Delphi, and they were trying to develop a national research agenda in emergency medical services, we went back and did some focus group work around that process and how the agenda actually came to be, and then that fed back to understanding to inform their implementation process of the agenda. And so it was really kind of a back and forth and leveraging that the richness of the qualitative data. They really wouldn't have known where to start or where to go without that. And so they actually ended up defining questions and pieces of the agenda using the qualitative data. So that was one example. We did a concurrent mixed method study where they were running an observational before-after study on implementing a new team to help with post-cardiac arrest. So people who have a cardiac arrest outside of the hospital get brought into the hospital. And this was a team that was supposedly going to come down and swoop in and help. The survival rate from cardiac arrest is very low, and so they were hoping that they could increase that a little bit. And so they were doing this before-after study, measuring all of these sort of utilization type measures. And I sort of twigged and thought, So this was a case where in the beginning of discussing the project, they weren't thinking mixed methods because it was driven by a quantitative clinical guy. And I went to him and we had a discussion, but he was a very open guy, and I went to him and had a discussion. I said, I think this is going to be one of those things where there's going to be a whole lot more going on. Yeah, 5 minutes? Okay. Than we think, and I think we should study it. And so his answer was, sure, you just go and do that over there. And so I said, okay. And so we did. And so it ended up being concurrent because we studied the two things, kind of in parallel to each other. And then what happened at the end is we came together purposefully and really sat in a room. So here's the miracle part. We sat in a room multiple times for long, 2-3 hours, and really chatted about how his results ended up being negative, and my results explained why. And so we came together and really were able to mix the methods. We didn't convert anything, so I don't convert data in that type of mixed methods analysis. But we talked about how the data spoke to each other, and so it was more of an explanatory mixing in that particular project, which was pretty cool. And then last we did one which was a bit similar. It was more embedded, so a priori we decided ahead of time that we would do a qualitative study of a large provincial implementation to improve wound care outcomes in home care. And what was really interesting about this is that there was lots of measures being batted about, but there isn't a whole lot that's well known about how home care actually gets enacted in Ontario. So there's a thing called home care. It exists. People, it's supported by the Ministry of Health, but how it actually runs day to day isn't well known. And so by being embedded in that study, we were really able to sort of mix all the way through. So go back and forth, and we ended up providing more formative evaluation as well as summative. So some of the things we fed back to them during the study actually changed their tack in how they were doing implementation of this project. So that was a bit more embedded. It wasn't at the end, but throughout we were able to use the qualitative information to inform the study. So I think oh yeah, these are my one must statements. You know, the three things that I say is that, you know, the people at the table have to be open to appreciating both methodologies. You have to commit to it a priori. It can't be the phone call after, because it does require design choices and analytic choices that that matter if you're taking a mixed methods approach. And you always have to maintain scientific rigor. And I think that it's very hard to imagine. Alex is going to tell us how, but for me, I'm going to be honest, I'm going to ask the question. It's hard for me to imagine maintaining a high level of training and expertise in both. So I think it requires people to be appreciative of the amount of training it requires to be a qualitative researcher and the amount of training it requires to be a quantitative researcher, and then share those things. That's how I come to it. Alex is going to tell us how to do it the other way. But one thing I've been finding as we've been teaching mixed methods in HPME, and I've seen others, I've spoken to students. At the student level, I'm, again, being very honest, I'm starting to struggle with doing mixed methods for theses, because to be perfectly honest, in training, you're not well trained yet in anything. And so, and having been there and having to start the slope to qualitative, I can't imagine having to manage my quantitative training at the same time. So that's a question I actually put to the group. I'm sure there's students in the group, I'm sure there's supervisors in the group, and I would love to have a bit of a discussion around that, because in some ways I have to always sort of hold back from saying to students, why don't you just do a really good qualitative study instead of, you know, not that it doesn't deserve mixed methods, but that's just a lot of work. And so are we doing a disservice to students by encouraging mixed methods? That's a question I put back. So I'll stop there. I'm probably over, but that's my 2 cents on the matter.
Yeah, thank you so very much. I appreciate that you have put the grounding well down so I can build on it. And I brought a few slides. That's you, right?
Oh, that's me. That was my last.
Okay, this is where I start. And this is how I see it. I think that the difference is good. And if we anchor it properly and train people well, that it might work. We might divorce at some point, but it might also work. At the end of this discussion today, I hope you will learn more about mixed methods. You will hear more about examples of other people doing it, and possibly you might get inspired to use this in your research. When I teach, every 20 minutes I make my students jump up and do 10 squats or jumping jacks, because I've learned from a woman who worked for NASA for 20 years. She was the director of a life lab in NASA, that if you startle the system every 20 minutes, you don't need to exercise. So I've kind of figured 20 minutes, 30 seconds every 20 minutes, it's worth.
Yeah.
So I'm not going to do that, but I want to involve you. Instead of jumping, let's try to get the brain jumping. When you see this picture, what do you see? Take a few moments. You have pens and papers. Just note down 3 things. What is it you see there? What's going on? You had an idea. Chemical sensitivity? Mm-hmm. Yes.
The color red.
Color red.
The brands have red bottles.
Mm-hmm. So color is jumping out. Yes. Anything else?
The fear in her eyes.
Mm-hmm. Yes.
I have 2 adolescent boys, so I see something related to graphic novels or Batman or something on her T-shirt that...
Okay. Wonderful.
Maybe it's not that, but I see graphic novels everywhere because of my boys.
Wonderful. Thank you. Yes.
The number of products and the space dedicated to each product and where they're located on the shelves. Up or
Okay.
down.
Okay. Thank you. Anything else that's different that you noticed when you saw this?
It's a woman.
Hmm?
It's a woman.
It's a woman? Yes, exactly.
Middle age.
Yes. It's
Yes, go.
Something must be on sale because that spot on the shelf is empty.
Yeah, there you go.
All right, there we go. Clearly, we are surrounded by people who think about descriptors. Because when I put this very same slide to students who are in quantitative side of things, they start counting. And they tell me exactly how many white bottles, red bottles, blue bottles, how many types of Tide, how many ultras are there. And it's a totally different story, right? But the beauty of what we have heard is that everybody had a different thing jump out on them, and everybody interpreted exactly the same picture in a very different way. And that's how I see mixed methods. We can observe the same thing. We can count the same thing. And it's going to tell a different part of the same story. And that's why I think, again, that marriage is, in a way, possible. For my research, I investigate falls in older adults. I adopted a methodology from aviation. Airplanes fall and crash. People fall and crash. Gravity is causing both. So why not adopt what aviation did in the past 20 years by reducing our chance of dying in an airplane crash from 50% to 0.001. So your chance of surviving a flight is 9.99. They did something well, and they did it in a very different way. They didn't just count. They were observing, they were describing, they were changing designs, they were changing airplanes, they were changing processes, they were putting in place new policies, international policies, procedures that have to be followed. So I was thinking, okay, how can we do this for older people so that they stop experiencing injuries or crashing after a fall? And I started from counting things, how many people fall, where they fall, why they fall. So some quantitative side. How many of them injure themselves, how many get the medical treatment. But it wasn't enough. It just wasn't telling the story. So I had to go in and talk to them. And one of my subjects fell when he tripped on a doorway. Actually, it's a space between his balcony and living room. There's a heating panel built into the floor, which is about 20 centimeters high. And he has advanced Parkinson's disease. So he hit that panel, and his head hit the concrete flower pot built into his balcony. Very serious head injury. And he told me the story of how this happened, but then he told me the story of his life and how everything that he lives every day got him to that point. And without that story, I wouldn't be able to understand what happens before we experience serious injury. We conducted a very interesting study in long-term care facilities. It's a case study where we wanted to understand the safety culture in long-term care. So the first thing we found, I'm going to advance the slide twice. So this is the first thing we found. It's a model. And you're not supposed to read anything. You're supposed just to notice that there are shaded gray areas on this graph. So I'm just going to tell you, in columns are 5 levels of safety culture. On the left side is the poorest level. It's pathological, like basically we have no safety culture here. And on the right-hand side is generic, which is what nuclear power plants have. So there, tremendous amount of training, tremendous amount of vigilance, responses, everything is in place because it has to be. So on the left-hand side, in rows on this table, are dimensions of safety culture. So some descriptors, some things that need to be in place for safety culture to be deemed okay or not okay. So in long-term care facility, the study, this is like a final conclusion of the study, the safety culture is on a pathological or reactive level. And I'm sure that in hospitals is a little bit better, but not far away. So we started with a model, with a framework, and then we went and did a survey similar to what we have in hospitals required for accreditations. And the survey told us a story how these dimensions of safety feature in this long-term care facility. The only one that they didn't have a problem with is fear of repercussions. Everything that's below 80 is area of interest, and everything below 50 needs to be addressed immediately. So overall culture in this unit, in this long-term care facility, was very, very poor, according to the survey. But we still needed to know why. Why is this so? Not just that this is the way it is, but what is making it the way it is. And one of the things, we got a lot of explanations through quotes, but one of the things that we have noticed, that best thing on a survey, that there is no blame culture within. Yes, maybe there is no blame culture of one person on a unit blaming the other, but there is a very, very strong blame culture coming from the top, actually above and beyond organization. So like on a policy level. So if something goes wrong, there was this funnel of blame that was coming, which was making people within the unit and the organization fearful. So survey gave us one picture, talking to people did not really confirm that. I would agree with you on the most difficult part of mixing, which is putting things together. How do you do this? And here in this case, it was the framework that helped us. So we aligned the results of the survey and the stories that we have heard along these dimensions of safety culture, created a matrix, put responses from a survey and items together with themes that we developed, and that told us where to put the shading on this table. So that's how we converged. The last example I'm going to talk about, and this will take us into next phase, next steps, is about video, use of video. A group of researchers from UBC and Simon Fraser University, led by Dr. Steven Rabinovich, has been collecting video data on falls in long-term care facilities for more than 5 years. And his group, they're biomechanists, and they're all engineers, and they count. So they created this amazing, super rich questionnaire. Which leg was person on when they fell? Was it forward? Was it backward? Afternoon? Morning? Before pill, after pill, before eating, after eating. They just sit down as a team and dissect every video of every person who fell in the common areas. And I came with this technique for investigating falls, and I said, okay, how can video help us explain what we have heard in the stories? Because it's there, it's in your face, you can see what happened. And not only that we know what happened to the person who fell, but we also know what happened to the staff. Where were they? What they were doing? What happened 24 hours before? So merging the visual data, and I think we'll have more and more of that, and I think we'll have more and more streamlining of data, because now we're equipping. There is a big group in Europe working on sensors, just like astronauts were equipped with every sensor. Houston knew exactly if their heart was, experiencing any problems, if they're breathing well, like, hey, John, you're not breathing well, please take 3 deep breaths. So now we're starting to do this to patients in hospitals, so that there is a constant stream of data, and this big data sets that are coming. What are we going to do with them? What is the story becoming now? How are we going to put that together? Is it just numbers that we're going to report, or are we going to put them in context of what happened when those numbers were collected? So I think there is another layer of potential and possibility for mixing due to technologies in the future. So what is your paradigm? What do you believe? Are you mixed up, or are you budding mixologists? So those are some questions I think we can address as we move along. And we can come back to this slide later.
Okay, I'm there. And it's just right and left, right?
I hope so. I can't see
Okay.
the screen, but I think you're
It
there.
was just right and left.
Yes.
Okay. Okay, well, I'm not going to be quite as cataclysmic as Paula made me out to be, because when she asked me what I might do, I was thinking, well, what would draw people into the room? Let's be really kind of extreme here. So I blathered off, and of course, when it came time to actually think through much more carefully what I was going to say and what I actually believe about mixed methods, it softened a little bit, and parts of it fell apart, of course. So you'll find it nicely aligned, I think, with my two pre-speakers. In many ways, I mean, it's been quite inspirational to hear about this, about the examples of what you're doing and what some of the possibilities are. I'm going to be talking about a more particular instance of mixed method, and so let me make my argument. I'm really a bit of a tourist rather than a scholar of mixed methods. Most of what I'm going to talk about is based on my career as a qualitative sociologist, methodologist in the land of the randomized control trial. So I've wrestled for a very long time with the relationships between qualitative and quantitative research. So I've got a lot to draw on, and I've got 15 minutes. So let me just explain what I'm going to focus on. Now, mixed methods, as we've already heard, can focus on can refer to many different things. It can talk about types of research designs, types of data gathering, types of data analysis, and methods and mixed methods can be within research traditions, like I do all the time. I mix all my methods all the time, or it can be across research traditions. And I'm focusing in my remarks today on across research traditions, specifically what I see as the most common variety of mixed methods in the health sciences, the within project combination of so-called qualitative and quantitative approaches. In particular, I think I'm talking most about the add-on approach, what I call the add-on approach to mixed methods, where a qualitative component is included in a predominantly quantitative project. Now, many of you will be familiar with the discourse on why mixed methods are a good thing, and Katie referred to several of them. The most common general idea I would flag is that the inclusion of qualitative components can offer more complete or comprehensive knowledge, i.e. it's the notion of triangulation, where the more perspectives you can get on a subject, the better. And it's also seen, as Katie said, as helpful for developing measures and illustrating statistical findings, humanizing a subject that can be seen as kind of cold, objective science. Qualitative is seen as being able to humanize it, can be used to try to explain unexpected results, and so on. And also it's believed that qualitative provides human stories that are good for knowledge transfer and for policy uptake. Now, I think you need to note that these contributions are framed from a quantitative scientific standpoint and cast from a qualitative, and it casts qualitative in an adjunct role. But from a qualitative perspective, or a qualitative standpoint, the value of mixed methods might be assessed quite differently, and that's what I want to talk about today. So let me start with my conclusions, then present my case. As currently practiced, and put forward by Cresswell and others, mixed methods is a formula that mixes approaches that are methodologically and practically misaligned and incompatible. And this compromises its capacity to question existing knowledge and to generate new value-added knowledge on health. In other words, to get the most out of the qualitative component. I'm not saying it doesn't work and there's nothing to be gained. I am saying it fails to capture the best of what qualitative can offer. And I'm going to offer 3 possibilities for actually making a value-adding mixed methods. So I'm not going to end where Paula implied I'd end, that this is no good and there's no way to go. I do have some visions for where one can go with this. So let me explain what leads me to these conclusions. First, I argue that qualitative and quantitative forms of research have differing and largely incompatible research assumptions and practices, and that this has consequences for mixing methods. Although, I mix methods all the time, there is such a thing as methodological chemistry. And some research elements simply don't mix well. So I want to suggest a few differences and incompatibilities between qualitative and quantitative models of research that don't mix well, that I'm familiar with. So first, they may not mix because they arise from differing interpretive platforms. A primary notion in mixing methods is that of using different kinds of data, numbers and words, for example. And I'd suggest that it's not the data qua data that matters, but the platform from which they're interpreted. Words can be assigned predefined meanings, then counted and measured. And conversely, numbers are just symbols whose meanings can be problematized. So my point here is that you can mix data and you can mix techniques, but not interpretive platforms. Thus, I would argue, for example, that a mixed qualitative-quantitative project is okay as long as it takes a consistent epistemological position. For example, it treats qualitative and quantitative approaches as sharing the same positivist assumptions about the nature of reality, which then makes sense of the idea that combining them, by combining them, you can achieve a more accurate or more complete account of reality. This claim doesn't make as much sense, however, if qualitative and quantitative approaches are seen to or are practiced as having contradictory underlying paradigmatic assumptions. It's clear from the literature, at least the literature that I've read, that the problems of incompatible epistemological paradigms is mostly ignored in the field of mixed methods. In the applied research environment, in the applied research environment in which we're located, concerns related to methodological philosophy are inconvenient. And they get cast as elitist or too purist or merely passé. And the discourse of a pragmatic middle way prevails. A common solution is to treat qualitative data and analysis from a positivist platform, which eliminates and obscures the problem of epistemological incongruence. Thus, mixed methods, I think, adopts a variety of qualitative research that I call post-positivist qualitative research, using qualitative data, but post-positivist forms of analysis. Many of the qualitative components of mixed method studies I've encountered treat data as speaking for themselves. They tend to be taken at face value, with little contextualization or interpretive penetration. Analysis consists of searching for themes, regularities that are seen as being inherent in the data. The themes are out there. In contrast, a qualitative interpretivist analysis understands themes as constructed through the theoretical lens of the researcher. That is, as not as preconceived entities that reside in the data awaiting discovery. So a second incompatibility stems from the fact that qualitative and quantitative ask different research questions, which is a bit of a takeoff from what Katie was talking about. the logic of much mixed methods is that qualitative and quantitative components are based on a common overarching research problem, and that they're just taking on different facets of the same problem, the same underlying issue. But the nature of the research questions asked in qualitative and quantitative are very different, and mixing them has consequences. Where qualitative approaches are applied to quantitative questions, a disjuncture opens up immediately between its methods and the form of the research question. Qualitative approaches are ill-suited to answer questions generated from a quantitative theoretical framework. Moreover, in qualitative research, the research question is a moving, emergent entity, not fixed at the outset, as in quantitative research. The purpose of much qualitative research is less to find an answer to a question already known, as much as to find the question that needs to be answered. This difference in orientation towards the research question is problematic, not least because in quantitative designs it's methodologically inappropriate to change the research question as you go along. The assumption of a shared research problem and different postures towards retuning the questions midstream can prevent the mixed elements from speaking to one another productively. So a third incompatibility lies in differing perspectives on the role of the researcher. In quantitative research, the role of the researcher is conspicuously downplayed, and the researcher is expected to be as absent as possible. Thus, for mixed methods designs, Cresswell calls for research that is free of what he calls, quote, researcher bias, revealing his belief in the possibility of lens-free research. By contrast, in many forms of qualitative inquiry, the researcher and his or her reflexivity are seen as pivotal. My own articulation of this is the notion of creative presence, I call it, in qualitative research, whereby the researcher is seen as a prime methodological tool that needs to be actively and self-consciously deployed throughout the research process, especially in the interpretation of data and construction of findings. So difference in the conceptualization of the researcher in the scientific process can be a profound problem for mixed methods research, primarily because it stifles the creative presence of the researcher, and with it, one of the greatest assets of qualitative inquiry. So a fourth incompatibility resides in differing conceptualizations of some core concepts, like, for example, the notions of perspective or experience and meaning. In quantitative research, these concepts are often treated as facts, as real entities out there that individuals possess, that can be documented and measured. So you go out there and you find out what people's perspectives are, what they think, what their ideas are, and so on, what their experience is. By contrast, qualitative approaches tend to understand such concepts not as fixed objects or individual attributes, as much as social constructions, impermanent, contingent on context and interaction in particular. So the problem of differing core conceptualizations is obviously way more nuanced than I can address here. But my point is that it makes it hard to blend qualitative and quantitative approaches in such circumstances. So a further mismatch between the approaches lies in understandings of corroboration and contradiction. Cresswell writes that in an intervention design, you want to look at how the qualitative results, quote, enhance the experimental results. There's a bit of language, I think, in one of your slides, Katie, that was a bit like this. Noting that qualitative research is useful because it, quote, makes the results more believable. Here and elsewhere in the mixed methods field, qualitative research seems to be understood as being about corroboration or enhancement with the aim of strengthening inferences. Seldom contemplated is the possibility of failure to corroborate when qualitative and quantitative findings are dissonant. Incongruent findings can trigger efforts to figure out which one is right, rather than to explain how each might be right and contradictory at the same time. The adjunct status of qualitative research in the project, often, not luckily in Katie's, combined with the generally lower scientific credibility accorded to non-numeric findings, can permit inconsistent findings to be ignored. This constitutes, in my view, a wasted methodological opportunity for qualitative research, where discrepancy is seen as a call for explanation and for re-investigation. So a final difference between the approaches exemplifies some of the more practical difficulties associated with mixed methods. And this refers to I'm talking about the differing capacities for flexibility and change during the research process. Many mixed methods design assert that the qualitative component can inform the quantitative, but opportunities for this during the conduct of the research is limited because of their differing methodological flexibility. Positivist quantitative research relies heavily on predefined procedure and rigorous standardization for its scientific credibility, while qualitative research relies on an unstandardized and continuous morphing of procedure and purpose. And its success is fueled by the capacity to continuously redefine and repurpose its methods. This difference in methodological flexibility makes it very difficult for qualitative and quantitative research to operate together, and is a structural impediment to joint knowledge production in mixed methods research. So all of these differences between them that I've identified, singly and combined, can undermine the productive capacity of mixed method studies. In my own terminology, I see these differences as obstructing the most important scientific contribution of qualitative research, what I call value-added analysis. Now, value-added analysis, I concocted the idea to refer to augmenting the worth of qualitative research by going beyond the explicit surface content of data, by going beyond the awareness and self-insight of the respondents themselves, by going beyond cataloging of preconceived concepts and themes, and by capitalizing on the researcher's capacity for critical insight and theorization. That's what I group under the notion of adding value to qualitative research. Now, mixed methods, through the differences I've just identified, can impede some of the drivers of value-added qualitative research. For example, it can hamper the capacity for engaging the creative presence of the researcher. It can make iterative change, sampling theoretically, reframing the research questions, all those things. It can hamper these things. And it can also hamper the contextualizing and the interpretation of data. Because all of these contribute methodologically to the conceptual generalizability of qualitative findings, their suppression in much mixed methods research can compromise the overall value of the qualitative component. I'm not going to go into generalizability here. We can maybe talk about it afterwards. So this is some of the logic underlying my conclusion that mixed methods as currently being practiced is not maximizing the potential of qualitative research. But how is one to respond then to such conclusions? What does it mean for qualitative and quantitative researchers leaning into or leaning towards mixed methods? What should we conclude? That it's a misguided enterprise and abandon it? Should we ignore the whole messy business and dismiss it as just a self-protectionist elitism of qualitative researchers and just carry on the way we are? Neither makes sense to me. If we call off mixed methods as misguided, qualitative research risks becoming misaligned with the current world of health research. We're in a postmodern era where pragmatism is in ascendance. As Miles and Huberman rather snuttily write, epistemological purity does not get research done. We are moving strikingly away from basic researcher-driven research towards applied research and evaluation, driven by funders, users, policymakers. to whom the discourse of mixed methods is very alluring, with its claims to getting the complete picture and of balancing methodological strengths and weaknesses, and of softening the hard edge of objective science. So in this context, the option of abandoning mixed methods is not a promising idea. Yet if we continue with the current model for mixing methods, are we settling for an underperforming and even a misfiring qualitative component and missing the opportunity to exploit qualitative research for what it does best, such as, reconceptualizing problems, such as questioning taken for granted assumptions that may be misleading our research and our practice, such as generating new insight and theory for the immensely important social dimensions of health. Carrying on in the same vein will also likely perpetuate the subordinate service role of qualitative research in mixed methods projects, what Green has charmingly called the paramedic role for qualitative research, in salvaging ailing quantitative evaluations. So how should we proceed vis-a-vis mixed methods, especially for qualitative researchers who arguably have the most to lose from either of these options? I propose that one way out of the methodological quandary I've put forward is through methodological growth and through the development of a generative form of mixed methods. Mixing methods in a way that enhances the joint achievement, makes the whole greater than the sum of the parts. So I see three possibilities of promise at the moment, and these are not well conceptualized and full of holes, but never mind, I want to put them out there for discussion. The first is, where cross-epistemological research is undertaken in a way that maintains paradigmatic integrity while producing fresh perspectives. In other words, it doesn't force the two both into a similar epistemological platform. You actually do something with inconsistencies, for example, rather than sweeping them under the carpet. Paradigmatic inconsistency can be a spark plug for insight, and I think this is a really important possibility for mixed methods research. Secondly, alternatively, one could retain the idea of a single paradigmatic platform while reversing the order of dominance. Mixed methods could be done from a qualitative platform, with the quantitative asserting the qualitative agenda rather than vice versa. This option involves a shift for qualitative research from an assistive role to a generative one. Morse and others have begun writing about this idea, or something a little bit like this idea. So the third and another approach is for both qualitative and quantitative models to move towards a hybrid epistemology. I don't want to kind of throw out there critical realism because it's been such a kind of obvious crutch for somehow dealing with this discrepancy in position. But it could function as a common turf where real, emergent, and contradictory realities can coexist with equal status, and where both and forms of scientific thinking can generate new perspectives on health phenomena. So here in this model, qualitative and quantitative approaches are reconciled through a common grounding in outside of them, both themselves. So in a common grounding in a critical platform. So the critical platform provides a different platform from which both qualitative and quantitative can speak, and that can potentially override the kind of difficulties that I talked about here. So I'm done.
Thank you all three for insights and for sharing your experiences so far. So I think what we'll do now is it's great. Thank you for sticking close to time with it. Got about 25 minutes now to open it up to the floor.
And I also wonder if people are comfortable just forming the rest of our circle, why don't you come in and join the discussion? We appreciate you sticking around outside the door all this time.
There's no front or back, please.
Denise, I'm going to turn off the recording now, right?
Yes, we can stop recording now. Thank you.
If I can.